So, and while I was checking his ear, that's also, before we go into the lymph nodes, I'm gonna assess for hearing problems, which is the cranial nerve number A, is the vestibular cranial nerve. So I'm gonna do a couple tests. One, I want you to cover your left ear, and I'm gonna whisper something, and you're gonna tell me what I whisper.
1, 2.
Perfect. We're gonna do the same thing on the other ear.
Apple.
Perfect. So that's called the whisper test. Now we're gonna do the Weber test. The Weber test is gonna check for lateralization. So what it does, it's going to tell me if there is any hearing problem on any of his ears. So I'm gonna instruct this. I'm gonna put this on the middle of your head, and you're gonna tell me if you're hearing the sound equally on both ears, or if you can hear more on one side.
I don't hear.
Can you hear it?
Mm-hmm.
Can you hear on both ears?
Mm-hmm.
Perfect. All right, so now we're gonna do something that is called the Weber test. So the Weber test is gonna check for the Rhine test. I'm sorry, we just finished with the Weber test. The Rhine test is gonna check for, again, hearing loss, and it's air conduction. So a bone and air conduction. So we're comparing the bone to the air conduction. So the air conduction should be less than the bone conduction. So this is what we're gonna do. Can you feel that? Tell me when you stop hearing it. Okay, so we're gonna do that again. You're gonna I'm gonna strike this. I'm gonna put it on your mastoid bones back here on your posterior. You're gonna tell me when you stop listening to the noise, and then we're gonna do here the same thing, and you're gonna tell me when you stop hearing the noise, okay? Okay. All right, so we'll do the same thing on the other ear. Can you hear it? Can you feel that? Tell me when to stop. Okay. Tell me when to stop. Okay. All right. So that it's the three major tests that we do for hearing problems. Now I'm gonna move to your neck. So again, I'm just gonna check for symmetry. Before I go into the lymph nodes, I'm also gonna check for cranial nerve 11, which is the test that I'm gonna do. I'm gonna push down on his shoulders, and you're gonna strap your shoulders for me. Perfect, perfect. All right. So now I'm gonna check for your lymph nodes. So for that, I'm gonna be palpating. And I should not feel any lymph nodes unless there's any disease process going on, such as like any upper respiratory or any malignancies. So I'm gonna start checking for your preauricular, which are on front of the ears, post-auricular. I'm gonna check for your tonsillar, which are here. I'm gonna check for submandibular and submental. Then I'm gonna check for anterior cervical, and I'm checking for posterior cervical, and back here, put your head up. I'm gonna check for the occipital. Perfect. Now I'm gonna move to subclavial, and I'm gonna move for infrasubclavial area. Check for lymph nodes, and I'm gonna check for axillary nodes. So if you can let me do this, and I'm gonna check for his axillary nodes. Perfect. And lymph nodes are being checked. Also, I'm just gonna check for his trach, and I'm gonna make sure that his trach is midline. I'm gonna go ahead and grab his trach, just stay straight there, and I'm gonna deviate it to one side, and it goes smoothly, and deviate it to the other side. I'm gonna have you swallow. Perfect. Keep your head just like this, still like that, and swallow. So what I'm doing now, I'm just checking for the thyroid position. So I'm just gonna assess his thyroid, and the best way to assess thyroid is to get on the posterior side. So I'm gonna kind of turn this way for me just a little bit. Perfect. And I'm just gonna get behind my patient and right below the isthmus of the thyroid. I'm just gonna go ahead and palpate. Go ahead and swallow for me. Perfect. Just right below the trach notch, and I can feel the isthmus of the thyroid. And you should not be feeling, again, you should not be palpating the thyroid, feeling the gland unless there's any disease process, such as thyroid disease. All right, you can come this way. So now I'm gonna check movement of your neck. So if you can turn to the left and right and up and down. Perfect. So we're doing extension, flexion, and internal. Let's do a little bit of rotation, internal and external rotation. Perfect. All right. So I'm gonna go ahead and move now to check your lung, heart, and your abdomen area. So the first thing that I'm gonna listen for your carotid pulse, and I'm gonna do it with the diaphragm and the bell of my stethoscope. I'm gonna feel for pulses first. Perfect. And I can see there's no GVA present, there's no jugular vein distension. So I'm just gonna go ahead and listen, and you should listen for a full minute. We're not gonna do it for the purpose of this video. And I should not be hearing any bruits or trills. Perfect. All right, that's perfect. So I'm gonna need you to remove your gown because I'm gonna assess your chest. So all the way while I do my assessment, I inspect the skin of my patient so I can see his skin is intact on his anterior cavity, and the same thing on his back. So I'm gonna go ahead and do respiratory assessment so I can see he's on labor breathing. He's not using any accessory muscles to breathe. His respirations are even, there's no uneven chest rise. So it looks like he is pretty good with his respiration. So from that, I'm just gonna move to palpate. So I inspect my cavity, I'm just gonna palpate. During the palpation, what I'm gonna be checking for any superficial skin growth, like any lumps or bumps. So I'm just gonna be checking. And while I'm here, I'm just gonna do something that is called tactile fremitus, which is a test that we do to assess if there's any respiratory problems, if there's any consolidations or any breathing issues. So what I'm gonna do, I'm gonna have you, and this is it's gonna sound like resonance. So what I'm gonna have you say, it's 99, 99, 99, 99, 99, all the time that I place my hand in different places on your chest, okay? So go ahead and say 99.
99, 99, 99, 99.
Okay, let's do it a little slower.
99, 99, 99, 99.
I'm gonna do the same thing on your back, okay?
99, 99, 99, 99.
Okay, and I can listen a good resonance, which is the normal sound that we will listen over the lung fields, starting here with the apex and the bases. So I'm just gonna do something that it's called egophony and bronchophony. What we're checking is just the same thing, but I'm gonna be listening with my stethoscope. So what I don't wanna hear any muffling sounds. If I hear muffling sounds, that will tell me that the patient may have some consolidation on his lungs, such as pneumonia or any respiratory problems. So what I'm gonna do, I'm gonna listen on the front and the back, and the first one I want you to continue saying 99. That will be for bronchophony. All right.
99, 99, 99, 99.
Perfect. We're gonna do on the back.
99, 99, 99, 99, 99, 99.
Perfect. Now we're gonna do egophony. So for egophony, what I want you to do, I want you to say the letter E.
E. E.
More longer per.
E.
Perfect.
E. 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 E.
And again, I hear normal normal resonance over the long fields. There's no muffling sound, so it's telling me he doesn't have any acute consolidations going on his lungs. So from now we're gonna do percussion. So I'm gonna kind of percuss, and the sound that I should be listening, I'm just gonna percuss on his posterior area, but I should be listening resonance over the long fields going to the rib cage. The sound will kind of change to kind of dual kind of sound. So I'm just gonna go ahead and tap on your back, okay?